Hola, muy buenos días a todos. Ya estamos por comenzar esta sesión informativa para la prensa. Vamos a dar unos
Good
segundos.
morning to all of you. We are about to start with this press conference. We are going to allow for a couple of minutes for all of you to connect in the various rooms, and we'll be right back.
Bueno, entonces, ahora sí, bienvenidos a todos.
Very well. Good morning to all of you to this press conference on the COVID-19 pandemic. My name is Sebastián Oliel. I am with the Communications Department with PAHO, and let me remind you that we have simultaneous interpretation into English and into Spanish, and you can switch to the various channels with the button at the bottom of the screen. We will have a 45-minute session. We will be accepting your questions. We have received some questions via email, and you can also do that through the button that indicates Q&A, and we will be addressing your questions and also giving you the floor to address the questions live, but please do write to us through the Q&A option. Please do identify yourself with the name and the agency you represent. This session can also be followed through the social media, Facebook, and Twitter. Today, our director, Dr. Carissa Etienne, will be informing you on the situation of the pandemic in the region and also the various factors that may have an impact on our response to the pandemic. With us, we have Jarbas Barbosa, the Assistant Director, Ciro Ugarte, who is the Director of Health Emergency, Marcos Espinal, the Director of Communicable Diseases, and Silvana Alighieri, Assistant Director for the Emergency Department and also Incident Manager for the COVID pandemic. So now I give the floor to Dr. Carissa Etienne to share her thoughts with you. Dr. Etienne, please go ahead. We're just having a minor technical issue.
So,
please.
A warm welcome to you, and let me thank you for joining us today. The Americas remain at the forefront of the fight against COVID-19. As of June 8th, we have more than 3.3 million cases reported in the region of the Americas, more than any other region around the world. Today, we are home to nearly half of all COVID-19 cases. Unfortunately, many areas are reporting exponential rises in cases and deaths, and we are concerned by data showing that the virus is surging in new places that had previously seen a limited number of cases. In Mesoamerica, case counts are rising in Mexico, Panama, and in Costa Rica, where we are seeing increased transmission around the Nicaraguan border. In South America, the virus continues to spread aggressively in Brazil, Peru, and Chile. We're also seeing in Venezuela that cases are now mounting faster than at any point during the country's outbreak. In the Caribbean, cases are on the rise in Haiti, and after more than a month without a new case, Suriname reported a spike this past week. Social distancing and stay-at-home orders have been challenging for all of us. But in the absence of a vaccine or more effective treatments, they are critical steps to keep us safe during this pandemic. It is equally important for countries to test, treat, trace contacts, and isolate patients. Without this combined approach, our efforts will have limited impact, and we face the risk of a rebound in cases. Today, I wish to draw attention to climatic factors affecting the response to COVID-19. As our region works together to contain the spread of COVID-19, we must start planning now for a formidable challenge that could make our situation worse. That is the weather. In South America, our response to the pandemic will be impacted by the arrival of winter, while hurricane season will complicate our efforts in North and Central America, and especially in the Caribbean. Let me start with how winter presents challenges for countries with rising COVID-19 cases. We don't have data showing that temperature or humidity influence the spread of COVID-19, but we do know that winter fuels respiratory infections like seasonal influenza and pneumonia that can rapidly spread in colder climates and as more people gather indoors to stay warm. This is a problem for patients because respiratory illnesses leave them at greater risk of severe COVID-19 infection. It's also a challenge for strained health systems that will have to cope with the dual burden of a coronavirus pandemic and a spike in other respiratory illnesses. It does not help that the similar symptoms will make diagnosing COVID-19 even harder. As countries strengthen surveillance for COVID-19, they must simultaneously monitor influenza cases. Early vaccination to prevent severe cases of flu is more critical than ever, particularly for high-risk groups like health workers, the elderly, and people with chronic conditions. These same groups are also at high risk of coronavirus infection. We have encouraged countries to adapt seasonal flu vaccination campaigns to fit current social distancing measures. Many countries have embraced this approach and introduced innovative methods of immunization that minimize the risk of COVID-19. This includes offering vaccines outside of health facilities, in empty schools, for instance, pharmacies, or drive-through posts in supermarkets. We have been encouraged that 14 countries in our region have begun to immunize 90 million people against seasonal influenza. More than half of the target population has already been vaccinated, a testament to the preparations and diligence of governments in the region. PAHO is helping countries secure the necessary doses of vaccines to reach this goal. Through the Revolving Fund, we pool resources to purchase vaccines from member states in an effort to expand access, to guarantee quality, and to secure better prices. This year, the fund helped secure 24 million flu vaccine doses. Virtually all of it has already been delivered to countries conducting campaigns, despite the added logistical hurdles that we are all facing in transporting essential supplies during the pandemic. As we move north across our region, countries in the Caribbean, Central America, as well as the eastern and southern coast of the United States are bracing for what many experts believe could be one of the worst hurricane seasons on record. More unprecedented still is the prospect of responding to a hurricane amid a pandemic. As storms ravage towns and communities, they decimate sanitation systems, they contaminate water supplies, and fracture the delivery of healthcare. 3 lifelines that are critical to containing the spread of COVID-19. For countries in the path of a storm, I remind you that PAHO is here to help you prepare and will be ready to support you in the event of an emergency. Now is the time to review national hurricane response plans and conduct simulation exercises to ensure your disaster and COVID-19 responses are aligned. We should also plan for potential disruptions to the care of critically ill patients and refine evacuation plans. PAHO has already issued guidance to manage emergency shelters, including precautions to minimize the spread of COVID-19 by designating distinct zones to allow for social distancing, regularly disinfecting high-traffic areas, and swiftly isolating individuals who show signs of illness. We are working to provide emergency response supplies throughout our region and to secure critical facilities like laboratories and quarantine and isolation centers so diagnosis and treatment for COVID-19 can continue even under difficult circumstances. The COVID-19 pandemic has pushed our region to the limit. Our communities and health systems are under duress, and our collective efforts are laser focused on containing the virus. Preparing for winter and hurricane season is a critical part of this fight. We must take action today to safeguard our progress and mitigate the spread of the virus during this time. And this means redoubling our efforts to control the spread of COVID-19 so that we reduce the dual burden the approaching winter and hurricane seasons might bring. It also means strengthening health infrastructure by hiring surge staff and expanding reserves of essential supplies and protective equipment. This will help ensure the work done to prepare for COVID-19 is reinforced to address these seasonal threats. The Americas region is no stranger to natural disasters or seasonal health outbreaks. Indeed, our experience navigating these challenges has fueled our resilience in the fight against COVID-19. We must rely on that experience now more than ever, just as we must rely on regional solidarity and partnerships. Our history shows that if we work together, we can overcome the worst. And this time is no different. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. And we will now go on to the Q&A session for the questions that we have received via email, and then we will move on to the questions that we received via chat. Like we said, we have to post questions using the Q&A icon, and we will take them from there and respond. And please identify yourselves by stating your name and the media you're representing. The first question comes from several reporters from AFP, Reuters, AP, Bloomberg, and via chat, Mariana Surjet, who are asking about Venezuela. I'm going to switch to English now.
Among the Ministry of Health from Venezuela, the representative for health from the National Assembly, and PAHO to look for resources for the response against COVID-19 in the country. Can you elaborate on the content of the agreement and what is PAHO's role and how this support and the seek for resources will be implemented? Dr. Etienne.
Thank you, Sebastian, and thank you for this question. Indeed, COVID-19 has been challenging for most countries, but this pandemic also provides a good opportunity to pursue health as a bridge for peace. It takes high commitment, courage, and a sense of urgency to put aside political and ideological differences to reach an agreement to protect the lives of the people. And so that is precisely the nature of the collaboration agreement that was signed in Venezuela, following multiple dialogues and negotiations that was facilitated by PAHO at both the technical and political levels. It is clearly a very important step, and I must say that PAHO is privileged to confirm its renewed commitment to continue serving the population of Venezuela. It is also a responsibility for us to deliver technical cooperation in keeping with humanitarian principles and to deliver with technical excellence. Although the agreement is an important milestone, it will require continuous, transparent, and unwavering joint work to deliver the results that all Venezuelans urgently need. I am glad to report that this morning, the Ministry of Popular Power for Health and the advisory team of the National Assembly met again in Caracas under the auspices of PAHO to discuss specific actions to save lives and reduce COVID-19 transmission within this agreement. So the parties agreed, among other things, to prioritize access to PPEs, medicines and supplies for treatment and ICU services, to decentralize testing, and to prioritize the states that are most affected. We in PAHO are optimistic and confident that concrete results are now closer than ever. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. And the next question comes from Anatoly Urmanaev from the New York Times, and it's in English.
Now have similar numbers of COVID cases and deaths per million despite adopting radically different strategies. Peru adopted all the best practices advocated by WHO, Brazil adopted none, yet the outcome has been similar. As Latin America countries begin winding down their lockdowns to stop the economic free fall, what impact can it have on the region? What incentives do countries have to maintain economic restrictions if the deadly outbreaks appear to be a question of when, not if? Dr. Barbosa?
Thank you for the question. This is a complex question because indeed you are asking more than 2 or 3 questions and make some assumptions that we need to discuss. First, I don't agree that Brazil has not implemented any measure to reduce the transmission. In Brazil, this decision relies on the governors, and almost every state in Brazil has adopted different packages of measures aiming to reduce the speed of the transmission, varying from quarantine measures, social distancing measures, lockdown measures. So we have a mosaic of distinct situations among the states in Brazil. Second, I agree that Peru implemented many important measures. Peru was one of the first countries to establish a very important economic support to the poor population. Other countries, including Brazil and other countries in the region, adopt the same measures afterwards, because it's very important to guarantee that the population will be supported if we want them to agree or to support or to adhere to a stay-at-home policy, for instance. When we look to the figures, the mortality rate in Brazil and Peru, they are similar. You are correct about that. But when we look in some states of Brazil, for instance, the Amazon state in Brazil, that is a poor state in the north, the mortality rate in Amazon state is almost 8 times, the mortality rate that we have in Peru. So I think that we need not only to the national average, but in some countries in the United States, you know, the reality is totally different when you go state by state. So I think that we need a more deep analysis to make the right comparison. About the difficulties, I agree with you that Latin America is the first region worldwide where the COVID-19 is hitting economies that have a large proportion of the economy as informal economies, that we have many families living below the poverty line. In some countries of Latin America, only 30 or 40% of the families have a refrigerator, so they need to leave their houses frequently to buy food. So it's a very challenging situation. The countries are adopting at the same time measures to reduce the speed of the transmission. social distancing measures. They are strengthening their health services. And in many countries, they are planning starting opening the economy, but they are being very cautious and they are following the recommendation to monitor the situation to be sure that in the areas or cities or municipalities or states, the transmission is controlled before starting open the economy, and to do this, monitoring very closely the epidemiological indicators and the occupancy rate of hospital beds and other indicators very closely. Thank you.
Gracias, doctor.
Thank you, doctor. The following question is from Sebastian Boeing from Bloomberg, and it's in English.
Are there any specific conditions in Peru and Chile, such as climate, urbanization, or popular density, that would account for the rise in cases per capita there despite quarantines and social distancing? Both countries have roughly 1/3 of their population living in the capital region. Could that be a factor? Dr. Aldigueri?
Thank you for the question regarding Chile and Peru. This question is also linked to some aspects that were characterized by Dr. Barbosa answering the previous questions. In Peru, the incidence rate is higher, you are right, in the big Lima area, including the port of Callao, but also in the Amazon region, the department of Loreto, and the northern Pacific coast, the department of Piura. In Chile, as for Peru, we have a high incidence rate in the big Santiago, the capital city area, but also in provinces of the Northern Pacific, Tarapacá, and in the deep south, I mean on the Patagonian side, the province of Magallanes. So what we have in common between these two countries and the big urban areas is high density of population. It is poverty that is related to overcrowded households with difficulty of the people distancing from their relatives living in very small households, but also this poverty triggers some different social mechanisms. It means that the people earn every day the money that they eat with. So they have to go outside, they have to look for work, they have to look for transportation, which is another challenge in terms of social distancing. They are looking for food, they are going to markets, which is also another challenge in terms of mass gathering. So we have in these big urban areas, of course, many risk factors and challenges for strictly implementing the public health measures. So we have a risk of amplification. This was also described in other areas of mega cities, the big cities of other countries of South America. We are seeing the big cities as an amplification area with all these layers of risk factors that I described. Thank you.
Gracias, doctor. Siguiente.
Thank you, doctor. The next question comes from Fernando Meles from Brazil. And then I'm going to move on to another question from Fernando. Question says, the president of Brazil threatened with withdrawing his country from the WHO, saying that it has an ideological bias. Could this action hurt Brazil in terms of access to vaccines and medicine to fight COVID-19? And also related to the issue of vaccines, not exclusively for Brazil, but in general, Emiliano Rodriguez from H&R Magazine says that there's certain concern in the research about vaccines not getting to all countries in time. Is PAHO concerned about this for the region? Dr. Espinal, could you answer this question, please?
Gracias, Fernando,
Thank you very much, Fernando, for this question. And the next one, the follow-up question related to vaccines.
Tiene una larga tradición
Brazil has
de
a long tradition of cooperation with WHO and
Brasil
PAHO.
ha sido un tremendo actor
Brazil
en
has been
todas las
a
Américas
major
y fuera de las
player
Américas,
in the Americas and
porque
outside
Brasil tiene
of
una
the
gran
Americas,
tradición de
because it has a
solidaridad
long-standing
y de
tradition of
panamericanismo,
solidarity
además que hace frontera
and
con 10 países.
Pan-American
Entonces,
spirit, in addition
la
to sharing a border with
organización
10 countries.
estará
So
presta
the
para
organization will
continuar
be
apoyando
ready
a
and
Brasil.
willing to continue to
No
support
vamos a
Brazil.
permitir que
We are not
vacunas o
going
medicinas
to
nuevas
allow new
no van a
vaccines
llegar a
or
Brasil
medicines
porque la
to not
organización estará
reach
presta
Brazil,
para
because the
facilitar esa
organization will be
llegada,
there to
por ejemplo, a
enable
través
and
de nuestro fondo
facilitate
estratégico
that
para
delivery. For example, through our
insumos
strategic
y
fund for
o medicinas, y
supplies,
también para
commodities, or
nuestro
medicines, and
fondo
also
rotatorio.
through our
La organización continuará trabajando
Revolving
con
Fund.
Brasil.
The organization
Pero voy un
will
poco más
continue
allá. La
working with
organización ha
Brazil, but
estado
let me
trabajando
take
en
it
estos
a step
momentos con la
further.
prioridad,
The
con
organization
COVID.
has been focusing on our
Hemos
priority, which is
facilitado
COVID.
la
We have
compra, la ayuda para la compra de 10 millones de
facilitated
test.
aid to
Hemos
purchase
capacitado
10
personal
million
de salud
tests.
en
We have
Manaus y en otras
trained
áreas.
health
Hemos
personnel in
realizado
Manaus and other areas. We
reuniones
have
virtuales de
held
educación
virtual
y web
training
seminars, como
sessions
decimos, le
and
llamamos.
training seminars.
Pero va más allá de todo esto.
But it goes
Brasil tiene una
beyond this.
historia de cooperación,
Brazil has a
produce
history of
vacunas
cooperation.
Brasil,
It
y la
produces
facilita a muchos de
vaccines
nuestros
and it
Estados
makes them
miembros,
available to
pero
many
también en
of
el
our
área de
member
salud
states.
mental,
But also
en el
it's a
área
key
de
player
controlar el
in mental
tabaquismo,
health,
en
in
las
tobacco
enfermedades
control,
transmisibles, larga tradición de cooperación en
communicable
tuberculosis,
diseases. It has
VIH,
a
malaria
long history
y
of
de no
cooperation in
transmisible,
HIV,
cáncer.
malaria, as
Pero
well
lo
as
más
non-communicable
importante, y
diseases
es
such as
donde
cancer.
nosotros
But the
creemos que
most
las acciones
important
del
thing, and where
COVID,
we believe that COVID-related
contra el
actions
COVID tienen un gran impacto. Brasil
will
tiene un
have a
sistema de
great
salud,
impact,
el
is that Brazil
SUS,
has
es
a
único, es una
health system
joya,
that is unique.
muy basado y que cubre
It's
todo
a
el
crown
país
jewel,
en la
and
atención
it is
primaria.
based on
Una
primary
epidemia que va a
care.
tener a largo
So an
plazo,
epidemic
el
that
rol del
will, in the
SUS va
long
a ser
term,
vital. Así que
will
creemos que
be part of our society, has to be
independientemente
addressed,
de,
and this
como
is
decía la
vital. So we
directora,
believe that
de las
regardless
cosas
of what the
políticas,
director says,
nuestra
all the
organización, la
political
OMS
differences,
y la OPS
our organization,
continuarán
WHO and
apoyando a
PAHO,
Brasil
will
para
continue
que las
supporting
vacunas, las
Brazil
medicinas lleguen
so
a la
that
población
vaccines and
de
medicines
Brasil. Muchas
can
gracias.
reach to the Brazilian population. Thank you very much.
La
Thank you
vacuna.
very much. Oh,
La vacuna,
one more
la
thing.
segunda
The
pregunta,
vaccine.
perdón,
The second
Sebastián.
question had to do with
Sí,
the vaccine. I'm
la
sorry
misma
for
respuesta, básicamente.
interrupting, Sebastián.
La
The answer is pretty much
organización
the
está
same.
trabajando con
The organization has been
trabaja
working
con la OMS, pero con otros socios
with
muy importantes en
WHO,
el
but
área de
other
compras
significant
y
partners in the area
suplidores.
of
Entonces,
procurement
tan pronto
and
tengamos
suppliers.
medicinas
So as
y
soon
vacunas,
as we have medicines and
no quede
vaccines
duda que la OPS
available,
va a hacer los mejores esfuerzos
rest
para que a
assured
todos
that
nuestros
PAHO
países
will do
llegue
its
la
best
vacuna,
so that
llegue
all
la
of our countries
medicina,
can get a
ya cuando
vaccine or can
estén
get the medicine
probadas y aprobadas
once
mediante
they
los
are
organismos
tested
también
and
regulatorios
approved
y mediante
by
los
the
ensayos
different
clínicos del lugar
regulatory
que en estos momentos
agencies
se
and the
vienen
clinical
realizando. Muchas
trials
gracias.
that are taking place at this time. Thank you very much. Thank you, doctor. Next question from Jennifer Capasi from Hama Network. The question is in English.
Status of PPE and ventilators in Latin America, and what are the main initiatives to provide adequate medical supplies to the region? What is the status of availability of hospital beds and ICU beds? Dr. Ugarte?
There are, the global market in general has not recovered yet at previous levels. And there is a need to increase production, but also to deliver those supplies to the countries that are in most need. In the case of the Americas, there is a general shortage of PPEs and ventilators. And the shortage is more noticeable in the places where there is an increase of number of cases. So in those areas, we are seeing that there is a higher proportion of healthcare workers that are getting infected with COVID-19, but also the population and the patients do not have access to critical care. In those areas, we are seeing that the distribution of PPEs is a priority, and the global supply chain, that is an interagency consortium to procure essential supplies, have been negotiating with all the countries and many other entities. And we are now seeing that those supplies are beginning to be sent to the countries. In the case of the Americas, there are many countries that will receive supplies in the next week or so. And we can mention Antigua and Barbuda, Bahamas, Barbados, Belize, Bolivia, Cuba, Dominican Republic, Nicaragua, Panama, St. Kitts and Nevis, Suriname, Venezuela, Ecuador, and Peru, to name the first ones that will receive those supplies. And those supplies are being negotiated through several channels. One of them is the country's own resources that through the PAHO Strategic Fund is the biggest channel to purchase those supplies that it would not be available for the countries if that channel will not be used. And the other area is the donation from international institutions that will also allow us to purchase for those countries that do not have supplies. And I would like to mention that each country is monitoring the availability of hospital beds and ICU beds. And we are seeing that the countries are implementing a sharp increase in the availability of those supplies, and even establishing modular hospitals or expanding the capacity, specifically in the areas where the number of cases are increasing dramatically. Over.
Gracias, doctor. Vamos a pasar a una...
Thank you very much, doctor. Now we are going to have some questions live. I am going to give the floor to Richard Ensor, who is with The Economist in Mexico. Richard, could you hear us? You have the floor.
Sí, muchas gracias. I will speak in English if it's okay. I will ask the director a question, which I've written also in the Q&A section. If you look at the data from the governments around the world, it shows that Latin America right now has become the global center of this pandemic. The number of daily new cases that we are seeing is, if you take a 7-day rolling average, it exceeds the peaks seen both in the United States and in Europe in early April or thereabouts. Now, both of those parts of the world fixed that situation by implementing very harsh lockdowns. And those kinds of lockdowns are not very common in Latin America. And indeed, lots of Latin American countries have already implemented lockdowns. And this increase that I'm describing has taken place with these so-called lockdowns in Latin America already underway. So with this in mind, where does your optimism come from that this situation in Latin America is not going to drastically worsen in the coming weeks, considering that the tool that solved this problem in Europe and North America is not being applied in Latin America?
Gracias, Richard. Doctor Espinal,
thank you, Richard. Dr. Espinal, could you please answer?
Thank you, Richard. I think I lost the last piece of the question, but I think it was you were referring to the fact of Latin American implementing lockdowns also, but seeing a higher number and being the epicenter of the epidemic. Is that correct? No. So I think Sebastian, that was the.
Yes, he wanted to know it's also how data show that Latin America has become now the center of the pandemic and why.
Yeah, indeed. And apologies for that. The Latin America, as you know, had more time to implement measures, indeed, because It affected first China and then Europe. But at the same time, we know that Latin America is the most inequitable region in the world, and also one of the most urbanized regions in the world. So we have big cities like Rio, Sao Paulo, Lima, in where they are surrounded by belt of poverty and inequities. So the same lockdown that was applied in Europe to a certain extent cannot be completely applied in Latin America and the Caribbean. If you look into account that the economies are shrinking in many of these countries, so and we have countries with a high informal economy, it's very difficult to implement a total lockdown. The other point is that in several countries in Latin America, the outbreak started with imported cases, and it didn't reach the poor areas immediately. So, and we have seen in some of the countries later at the latest peaks, that meaning also that, and we know that is going into the areas where poorer people live, where people live in more crowded conditions. So the situation is that that while Latin America had more time, it will take more time to ensure slowing down the peak, the pandemic, and also reaching the plateauing the curve. It will take more time, and that's why we recommend in countries, if you are going to reopen, you have to do it first, to do a proper analysis, put together in the same table economic, financial people with public health people, but also do it by phases, because it's not going to be a situation that, in other words, we're going to have COVID for some more time, and June is a critical month. So it is expected that Latin America could have a big impact in terms of being the epicenter because of the situation and the characteristics of the region. We have middle-income countries, but also low-income countries, and many of the middle-income countries are in the lower category of middle income. I hope that's answer your question. Thank you. Over.
Gracias, doctor. Le voy a dar la palabra.
Thank you, doctor. Now I am going to give the floor to Uriel Velázquez with Despacho 505 from Nicaragua to ask his question. Can you hear me? Yes, please go ahead. My question is the following. Rather, I have three questions. Nicaragua, I would like to know, because Nicaragua has been indicated as a country that has reduced its response to COVID because some doctors have been dismissed. So during this press conference, we have received 3 new reports of dismissals of doctors in Nicaragua. What does PAHO have to say about this? Is it true also that the government has rejected a mission from PAHO? You already have a permanent representation in the country. What is the representation doing to cooperate in this emergency? Dr. Ugarte already mentioned that supplies will be sent, medical supplies will be sent to the country. Who would like to know what the donation is about, the protocol that is being followed to make sure that these supplies actually reach those that need them, because some doctors have also indicated that there have been some donations from other countries for face masks, but they are not reaching to the hospitals. And finally, I would like for you to share with us a projection based on the latest information that you received on the country. Thank you, Oriel. Dr. Ugarte, could you please address this question? Yes. The situation of health workers throughout the country, and in particular in Nicaragua, is a situation that needs to be given priority. Those individuals that defend health and the lives of people should also be protected in all of the areas. And in this regard, This is also a specific call for health workers, doctors, nurses, technicians, lab workers, and all of those who are contributing to this response to COVID are protected. The second topic that has to do with what PAHO is doing. PAHO continues to provide cooperation, technical cooperation, and sending updated manuals, documents, spreading communications and information through private and public channels. But also in connection with the supplies, we are also expecting an additional delivery of tests, diagnostic tests, but also PPEs. I could also refer to face masks. We have 93,000 masks, gloves, 166,000, gowns, medical masks, close to 100,000. So the number that we are sending is close to 1 million, and they will be arriving to the country over the next couple of days. So we need to make sure as to how to make sure that those supplies get to those who need them. That is a joint task, and we have also been working with different parties in Nicaragua to make sure that those supplies are sent to those who really need them. Our vision as to the cases and community transmission in Nicaragua is as follows. They do require the response from all of the sectors, and it should be transparent and open. And in this regard, it is very important to indicate that some of the measures that we are discussing and also the questions addressed before in connection with social distancing need to be implemented. And we are seeing that the population in Nicaragua voluntarily, as well as the scientific associations in Nicaragua, are also working for that social distancing actually to take place. We are still concerned. We do hear about calls for markets and demonstrations without proper protection, personal protection, and we have seen that in those cases, the number of deaths and also the cases of transmission may go up significantly. Thank you. Thank you, Doctor. We have several questions, and the following is a question by Olive Gonzalez from Trinidad and Tobago Newsday, and also Pinheiro from G1 in Brazil, and they say,
yesterday, an official at the WHO said that the spread from COVID from an asymptomatic person is rare. And they want to know if we agree with that, and also if people should keep wearing masks in that case. Dr. Aldiguieri, could you take this question?
Yes, thank you for the questions, for the two questions, in fact. Yes, we share the same views as the WHO technical lead that was interviewed yesterday. PAHO and WHO are doing on a regular basis, I would say every day, and we published almost every other week an update about the scientific literature, about the articles, about the new evidence that are found through scientific surveys and investigations. So in this case, it is very important to make the difference between asymptomatic people that are not presenting any symptoms at any moment of their disease and pre-symptomatic people that are not yet with, for example, fever and cough. So what the evidence at the moment shows is that it's less likely to have transmission from people that are totally asymptomatic with no symptoms at no moment compared to the people pre-symptomatic. And how we know that? It's mainly through the contact tracing and the cluster investigation, where patients' contacts, symptomatic, pre-symptomatic, asymptomatics, are clearly identified. The second part of the question is that in this context of permanent research and review of research, the guidelines from WHO have been updated and published during the last days. And there are specific recommendations for both healthcare personnel and for the public. And doing the difference between the scenario, the tables and the list of scenario are quite long, between the use by the public, non-medical mask, and the use of medical mask. So I will just highlight a couple of examples. In some situations where the social distancing is almost impossible, for example, in the transportation context, the use of non-medical masks is recommended. And in other situations, when we are talking about people with very vulnerable people, depending on the age group and depending on their comorbidities, the use of medical mask when in social activities is recommended. So I really would like to recommend to our colleagues to check both WHO and our website, where all the details are available regarding the update of this guidance. Thanks a lot. Over.
Gracias, doctor. La siguiente pregunta.
Thank you very much. The next question is from Valeria Heredia from El Comercio, Ecuador. She's saying that in the countries there were various alerts about an outbreak of measles in the region. What is the progress made? How many cases have been reported in countries such as Ecuador? And how could this have an impact on the health system amidst this pandemic of COVID-19? Dr. Barbosa. Thank you very much for this question, which I consider is very important. The other diseases that are also a priority also need to be properly cared during this period. And here we include vaccine preventable diseases, VIH, tuberculosis. So the situation is that we only have an outbreak of measles in Brazil. In the other countries where, for example, in Mexico and in Argentina, where we saw transmission, the transmission has already been halted. So the situation is only current in Brazil. In Ecuador, we had one suspected case, and there was a positive antibody test, but the PCR was negative, and now we are awaiting the result of the second sample, of the second specimen, but it means that it could be a false positive case because there has been no other contact with other measles cases in the region, but we still need to maintain surveillance in connection with measles cases and other diseases, and also to guarantee access because of all the care that is needed, also to guarantee the work of technicians that are working on the vaccination of these individuals. Thank you.
Thank you, doctor. And right now we have a live question from Financial Times, Irion Young. Irion, you have the floor. You can ask your question.
Thank you, Sebastian. So my question is, what are your thoughts on the number of excess deaths in the region? And by that, I mean a comparison between the death rates from all causes in the region during the pandemic and the death rate from all causes in the same period of previous years when there was no pandemic. And the reason I ask this is because we recently did an analysis of excess deaths around the world. And one of the areas we looked at was the province of Guayas in Ecuador, around Guayaquil, where there have been around 1,400 deaths from COVID-19 officially. But if you look at the deaths from all causes, there have been more than 12,000 more deaths from all causes between January and May this year than there were in the same period of previous years. Obviously, we don't know the cause of all those excess deaths, but they suggest that the number of COVID deaths could be significantly higher than is being reported, maybe even 7-8 times higher. So my question is, what are your thoughts on the rates of excess deaths in Ecuador and elsewhere in the region, and how seriously should we as journalists take these excess death figures as a possible measure of COVID fatalities? Thank you.
Gracias, Gideon. Quizás Dr.
Thank you, Gideon. Dr. Ugarte or Dr. Alighieri may be in a position to answer this question. Go ahead. Okay, well, let me begin by saying that, in fact, we have seen an increase.
Yes, many countries in the world, in Europe, North America, South America, and in other places, there is an increase on excess of mortality. And there are investigations and researchers that are being looking to the data. And yes, most probably there will be a number of deaths that will be related to COVID. But also, I would like to emphasize that there is also a problem with the availability of health services for other diseases. And that may explain also an increased number of deaths. But in particular, when we saw an epidemic of this nature or other nature, we usually look at the number of deaths are less in the numbers, for example, for other related diseases like respiratory diseases. Okay, the population are taking more precautions regarding the transmission of those respiratory diseases, and at the end, we may see a reduction on those type of deaths in comparison. But just to summarize, that this is something that is being looked at, and the results may come later, probably several months from now. Over.
Gracias, doctor.
Thank you, doctor. And now I would like to give the floor live to Gisela Salomon from AP.
Sí, buenos días.
Gisela, go ahead.
Yo quería
Yes, good morning.
preguntar cuál era la
I wanted to
posición de la
ask
Organización Panamericana de la
what
Salud
PAHO's
sobre la decisión de
position is
Brasil de
regarding
dejar de
Brazil's
reportar
decision
los datos totales
to
de las
stop
infecciones y muertes,
reporting
y también en
total
general qué
figures
opinan sobre el
for
manejo de los
infections
datos de
and
parte del
deaths, and
gobierno del
also
presidente Bolsonaro.
what their opinion is regarding President Bolsonaro's handling of the data. Thank you, Gisela. Dr. Espinal, could you answer this question, please? Thank you very much, Gisela, for that question. Countries can review their data. We saw this when the pandemic data, China did that. The same happened in New York, because if new information comes in, it's not a bad idea to review or revise our own data. But Brazil has a long history of reporting their data, and it has a strong surveillance system that gathers a lot of information and variables. So reviewing data is not a surprise. Now, what we do recommend is to continue reporting data to all countries, because this would enable us and government, allows us to have a clearer picture of what's happening, and it enables policymakers to plan for where the priorities will be based on the places that are most affected by the pandemic, and also see how we can help. So the idea is that we continue to urge countries to report their data, and we will continue to work with all of them. But reviewing their own data is something that the countries can do, and it has happened. But our suggestion is for the countries to continue to report their data. Thank you. Thank you, Doctor. And we're nearing the end of our session. Thank you very much for joining us. And the next question that we have received from several journalists has to do with PPEs and oxygen.
Prices for needed products such as PPEs and oxygen. what is PAHO work with countries and suppliers to find that balance between price, quality, and strong supply chains? Dr. Etienne?
Thank you for this question. In fact, since January, countries around the world have struggled to gain access to the key supplies and equipment that they need to save lives, to protect healthcare workers, and to better understand the prevalence of the COVID-19 virus. In fact, there were market failures. The global markets for respirators, personal protective equipment, and lab testing supplies reeled in response to the tremendous needs and the difficulties of increasing production while at the same time observing social distancing. So in those early days, PAHO sent 27 tons containing more than 1.4 million critical PPE items to 25 countries from its own stockpile at the regional emergency warehouse in Panama. We were helped by an unprecedented global supply chain that was established by WHO and other UN agencies and main international stakeholders to tackle that very challenge of supplying equitable access and delivery where they were needed. So you heard Ciro earlier. Actions are now underway to transport public health goods from Asia to Latin America and the Caribbean. And that's going to be done through PAHO's emergency warehouse in Panama. So this week, personal protective equipment will begin to arrive to this region from that source, including gloves, surgical masks, N95 masks, surgical gowns, goggles, and face shields, all of which are urgently needed in our healthcare settings. So the goods now in the pipeline may reach some 6,000 metric tons, which is worth more than $100 million. Most of these supplies are being purchased using the PAHO Strategic Fund that has enabled 12 countries to procure equipment and supplies from high quality and safety standards at a fair price. So we are especially grateful to the global support that we've received from WHO, but that global support to WHO as well, and the regional support to the Americas from important governments, Canada, Great Britain, India, and Japan, as well as the European Commission, the World Bank, and the UN Central Emergency Response Fund that provided a donation of some US $30 million to provide much needed supplies and equipment to countries in need. So we initially provided them, but there has been increasing needs, and through our strategic fund and through the global supply chain task force, we are looking to help member states to procure the supplies that they very much need. Of course, we need to say that in a situation like COVID-19, access to supplies, to equipment, to treatment, and to a vaccine when that becomes available, that this is essential to allow us to respond. And it must be done within a context of equity, within a context of solidarity, ensuring that those who need it most have access to it. So thank you again for joining us, and see you next week.
Muchas gracias, Dr. Etienne.
Thank you very much, Dr. Etienne, and thank you everyone for having joined us for this session. And please remember that on the PAHO website, you will be able to find more information as well as data for cases and deaths by country and also regional. And briefly, we will be sending the director's remarks as well as this recorded session. And since we have not been able to answer all of your questions, please remember that you can continue to reach us via our email, and we will try to answer as soon as possible. Once again, thank you very much for joining us, and we'll be in touch.